right now, the iron law is thrashing the states of North and South Dakota. You'll remember that this summer, just over a month after the Czechs were celebrating in Prague, the Sturgis motorcycle rally drew more than 250,000 people to Sturgis, South Dakota in early August. Public health experts now believe that rally seeded a massive outbreak in the Midwest within just weeks. Remember, this is the graph for the Czech Republic, the worst outbreak for any country in the world right now. Well, this is the graph for the outbreaks taking place in the Dakotas. Right now, South Dakota, the home of Sturgis, is averaging 793 cases per million. North Dakota's average is even higher, 918 cases per million, meaning that state, if it were its own country, is suffering the worst coronavirus outbreak in the world right now. Dr. Joshua Wynn is on the front lines of that outbreak in North Dakota. He's dean of the University of North Dakota School of Medicine, the state's chief health strategist, who's warned the state needs to take rising COVID cases seriously. I really appreciate you making some time, Doctor. Give us what your sense is of how things are in your state right now.
Well, good evening, Chris. And I think you got it right that the numbers are clearly headed in the wrong direction. You know, I think North Dakotans got lulled by that law that you were talking about, where when the pandemic started, we were relatively immune. And I think we let down our guard, and now we're paying part of the price for that.
You know, one of the things I think early on, right, when you had the outbreaks concentrated in fairly dense and urban areas around Detroit, around New Orleans and Louisiana, and then around the New York metro area, there was a sense that density, related to this, right, that denser places were more at risk. And one of the things we're seeing now, particularly in your state, neighboring states throughout the upper Midwest, is this is hitting fairly rural places pretty hard.
Exactly right, Chris. One of the things that we've seen is that migration to more rural places. The other thing that we're seeing is that the population that's being affected is also younger. So in North Dakota right now, the most common age group to be affected by COVID-19 is the 20 to 29-year-old age group. And we think part of that relates to not large gatherings, as you were talking about with Sturgis, but in addition, smaller gatherings where young people get together.
You know, we've seen that in other places. We saw it in the summer where the first wave of people infected tend to be younger because they were engaging in more sort of high-risk behavior. But it's been very hard to stop that from getting to older populations. What's being done right now at a policy level in your state to try to contain this thing? Because we know where that graph goes, right? We've been through this before.
Yeah, well, exactly right. The real risk from COVID, while it extends across the board, is in vulnerable populations. So we've been really focused on long-term care facilities throughout the state. So as you probably know, we have a very aggressive testing protocol, especially in long-term care facilities. One of the reasons our numbers are up is because we're doing so much testing. Now, that is a good thing so that we can identify who has it, who are contacts, and so forth. So we are really focused on trying to protect our vulnerable populations, the older segment of the population and those with pre-existing conditions.
You know, one thing that really struck me this summer that sort of learned from the Sun Belt outbreak, particularly in Arizona, was there was a kind of, it was brutal and painful, and lots of people died who I think probably didn't have to. But there was a kind of thermostatic relationship between public behavior and case counts that we did see behavior change in Arizona. When the cases were low and the outbreak was being seeded, people were out, they were drinking, they were hanging out with each other. They masked up, and they stopped doing that when cases went up. Do you have indications of local policy or behavioral changes happening in your state to break the back of this thing?
Yes, that is occurring, and it's happening at the local level. So, for instance, here in Fargo, North Dakota, where our home is, the mayor just yesterday had a proclamation about the importance of masking for citizens in Fargo. There you see Mayor Mahoney with that proclamation. So we believe that it's really important, but especially in North Dakota, local influence really makes a difference. And Tim, who, by the way, is also a physician, is very well known in the community. And I can assure you that for people who live in Fargo, hearing Mayor Mahoney say you need to wear a mask does a lot more than you or me saying it, Chris.
Oh yeah, I wouldn't deign to tell the people in North Dakota what to do, but I'm glad there are people, local folks that are saying that. I guess my final question for you is, one of the things that we saw in these outbreaks that were in metro areas is they were places with fairly high hospital capacity, even if they were overwhelmed. We've seen reductions in rural hospital capacity across this country for years now. Many people suggest we're now kind of paying the price for that. What is hospital capacity looking like in your state?
Yeah, so the good news is that we are in reasonable shape as far as hospital capacity. That isn't to say that there aren't some hospitals that are being stretched somewhat, but throughout the state, we do have adequate capacity. The important thing, again, is to not rest on our laurels. We need to change the direction of that curve so that we don't get into a catastrophic situation where we run out of bed capacity.
All right, Dr. Joshua Wynn in Fargo, North Dakota. Thank you so much. I really appreciate you speaking to us tonight.
Pleasure to be with you, Chris. Thank you so much.